I'm checking your temporal. The temporal, no pain, no tenderness? Okay,
No.
I'm checking the bilateral temporal pulses. It's present. I'm checking the temporal mandibular joint. Can you open your mouth? There is no any pain, any tenderness?
No.
Involuntary, okay. And then I'm checking the sinus frontal. Any pain, any tenderness?
No.
And how about mandibular sinus? No tenderness?
No.
Pain? Okay. And now I'm checking your eye. I'm using the eye chart to, in reality, we have to check from 2020. And then right now for the recording purposes, I'm checking this 6 feet.
Okay.
And please cover your right eye and read the last line for me, please.
LTFPH.
Okay, thank you. Can you cover your right eye, left eye, and read the last line?
LTFPH.
Please uncover your both eye and read the last line for me, please.
LTFPH.
Okay. Your vision is 20/20, which is normal.
Okay.
Thank you. And now I'm going to check, inspect your eye. There is no to see any bulging, any lazy eye, and the electric the eye is no drainage, no discharge. And I'm checking your convergence. The pink color, and sclera is a white, and pulling your eye to see an iris, and corona is normal, no any scar or lesion. Okay. And now I'm checking your pupil. Okay, I'm gonna put, okay, let me check first. I'm gonna shine the light to your eye to see you have a reaction to the light, your pupil. Okay.
Okay.
I'm sorry. Is that okay? I'm gonna put my hand on top of your head.
Sure.
Okay. Just look straight.
Okay.
Okay. Okay. Bilateral eye has a reaction, the pupil reaction to light. And also I'm checking for the consensuality, okay? I'm applying the, shining the light to the left, and the reaction of pupil, I can check on right side. Okay, the right side has a reaction to light. I'm checking the opposite side to see the other side pupil reaction. Yes, it's normal,
Okay.
both bilateral. And now I'm checking the extra ocular motion, which is you have to check the central nerve 3, 4, and 6, which is you have to look the tip of my pen and follow, please.
Okay.
Okay. Okay, and I'm checking there is no any nystagmus for the jerking of your eye, which is normal. I didn't see anything. And now I'm checking for convergence, which is I'm gonna just look at the tip of my pen, and then I'm gonna bring it close to your eye. Okay. Just look straight. That's normal. Okay. And then also I saw the accumulation of your both cornea, okay, the same time bilaterally, which is normal. And then I'm checking for confrontation, which is I'm putting my bringing my finger to close to your eye, and then when you see my hands, and then let me know.
Okay. You can see it now.
This side.
I can see it.
Okay, I'm gonna put on both, bring them to you.
I can see it now.
Okay, which is normal, they're all bilaterally, okay? And then I'm checking with my ophthalmoscope. ophthalmoscope. I'm checking your for red reflex and your optic disc and my right eye to your right eye, my left eye to your left eye. Okay? Is that okay? I'm going to put my hands here.
Sure.
Okay, I can see the red reflex, okay, and also the optic nerve disc shape is sharp, and the color is the yellowish, and the vein is no inflammation, okay? And I'm checking the other one. Okay, and this one, and also I can see the red reflex, and I can see the optic nerve, an optic disc also. The shape of optic disc is the yellowish shape is sharp and central. Okay, thank you. And no inflammation in your both eye. And now I'm going to check your ear, your external ear. First, I'm inspecting the helix and pinna, the around and behind. No any scar, no laceration, no any aberration. Okay, no bump. Okay, and I'm checking this side, opposite side of your ear, the helix and pinna, and no any laceration behind your ear and here around. No any aberration and any laceration. Okay. And now I'm going to check for whisper, which is you have to cover your one ear, and then I'm going to whisper the 2 words, and then if you can hear, and then let me know. Okay. Can you please cover your right eye?
Red and orange.
Perfect. Cover the other one, other side.
Red. Close and open.
Perfect. Okay. Both is bilaterally you can hear. I'm gonna check your Weber. I'm gonna check with the toning fork, and I'm gonna apply this one, the toning fork on your top of your head, and then just let me know when you can hear in both ear. Okay? Can you hear in both ear?
Yes.
Okay. Now I'm checking the Renin test, which is to see the air conduction if it's greater than bone conduction. Okay. I'm putting the toning fork and the mastoid bone. Just let me know when it's stopped.
Stop now.
Okay. How about here?
I can hear it.
Okay. I'm applying to the mastoid bone. Let me know when it's stopped.
It's stopped now.
Okay. How about here? Can you hear?
Yes, I can hear it.
Okay. Which means normal. The air conduction is greater than bone conduction, which is normal. And now I'm going to check your nose. I'm sorry, I forgot one thing. Let me check the cone of light. Actually, I'm gonna check the internal.
Okay.
Your internal your ear. Okay. Let me change. Okay, let me put it up. I'm gonna check your internal of your ear to see the tympanic membrane, okay?
Sure.
I'm gonna put my the hand for the safety, okay? Just I'm pulling the helix up, okay? And I'm gonna check your inside, okay?
Sure.
Okay. Now I can see the tympanic member color is gray, and cone of light is 5 o'clock on the right side. Okay, let me check the left side. I'm gonna pull up your helix, and I'm gonna check this side. I can see the tympanic member, the color is gray, and the cone of light is on 7 o'clock, which is normal.
Okay.
Now I'm checking the nose, okay?
Okay.
Anything tender? No. Her lymph nodes are non-palpable and not tender. Can you push your head down to that side? Perfect. And that side? Perfect. Shoulders up. Awesome. And then can you have range of motion this way? And up and down. And then ear and ear. Okay, neck is full range of motion. Neck moves freely. Strength is 5 out of 5. Next, we are going to move on to the hands here. Use your hands. Skin is cool to touch. Or excuse me, fingers are cool to touch. Hands are warm, smooth. They're dry. There's no lesions present. The turgor has a quick return, signifying hydration. The capillary refill is less than 3 seconds. The nails are clear and round. Let's see, texture is soft on her skin. Color is accurate for her ethnicity. Okay, let's move on to your chest here. Thoracic cage looks symmetrical. Shoulder muscle present. Skin, I'm gonna look down your back real quick. Skin looks dry. Matches ethnicity, no lesions present. Let's see, do you have any tenderness or pain?
No.
Perfect, no lumps or tenderness present. Let's see, breathe in for me. Breathe out. Breathe in. Breathe out. Perfect. Symmetrical exhale. Okay. Tell me if you have any tenderness, okay? Tender?
No.
Tender?
No.
Perfect. I'm gonna go ahead and listen to your lungs back here, okay?
Yes.
good. I'm going to listen to the front as well. Your respirations look symmetrical and unlabored. Unlabored, and your no accessory muscles are being used. I'm gonna feel, okay? Any tenderness?
No.
No. No lumps or tenderness present. Perfect. Okay. Breath sounds on the anterior and the posterior side were both clear with no adventitious sounds heard. Okay. Next, we're going to go to the heart. If you could just lean towards me. Perfect. No murmurs heard. I'm going to feel down here, okay? Perfect. Apical pulse is present. All right, the apical impulse is heard at the fifth intercostal space, the mid-clavicular line. The rate and rhythm is regular. Okay, I'm gonna listen to your heart in 5 spots, okay? Starting with the aortic. Moving to the pulmonic. Next is Erb's point. Then tricuspid. Then mitral. Perfect. Listen one more time. Aortic. Pulmonic. Erb's point. Tricuspid. And then mitral. Okay, so with the diaphragm, the S1 and S2 sounds were present. No S3 or S4, no adventitious sounds. And with the bell, no murmurs were heard. Okay, next I'm going to have you lay on your left side. All right, I'm gonna listen down here. Perfect. No breathes are heard. And then on your back. And access your abdomen. Is it alright if I pull up your shirt?
Yes.
contour is flat and symmetrical. Skin looks dry and pink. Color looks correct for ethnicity. I'm gonna go ahead and listen for the vowel sounds. Alright, vowel sounds were about 20 gurgles per minute in each of the 4 quadrants. I'm going to listen to the aorta for some vascular sounds. Perfect, no murmurs there. Next, I'm going to percuss here. Let me know if there's anything tender, okay? Sorry, my hands are cold. Correct. Timpani there. Let's see, some light palpitation. I like palpation. Any tenderness?
No.
Perfect. And then a little bit deeper here. Awesome. No pain, no tenderness.
Lesions. And now I'm going to be looking at the anterior eye structure. So I'm just going to be pulling the conjunctiva down. Keep your look up. So I see that the conjunctiva is pink and moist with no evidence of erythema. The sclera is white with no evidence of jaundice. The iris is brown, round, and bilaterally symmetric on both sides. And looking at the cornea, I see that it is transparent, dome-shaped, and smooth, no evidence of massive lesions or nodules. When looking at the patient's pupils, I see that they're round, black. And now I'm going to be performing some eye exams, okay? So the first exam is going to be the 6 cardinal fields of gaze, which tests cranial nerves 3, 4, and 6. So I'm just going to have you follow this pen with your eyes, okay? Okay, here we go. Okay, so upon completion of this test, the patient was able to smoothly follow the pen throughout all 6 cardinal fields of gaze with no evidence of nystagmus. So this proves that cranial nerves 3, 4, and 6 are intact. So now I'm going to be performing a corneal light reflex test. So I'm going to please have you stare straight, and I'm going to shine a light in both of your eyes, okay? Okay, so I see that the corneal light reflex is bilaterally symmetric on both sides, which means that cranial nerves 3 and 7 are intact. And lastly, I'm going to be testing pupillary response, which is going to be for cranial nerve 3. And I'm going to be having you stare straight. I'm going to shine this light directly into your left eye, okay? Okay, so I see that the left eye briskly constricts as I apply direct light. And now I'm going to be putting my hand right here. I'm going to be doing the same thing, going and stare straight. Okay, so I see that the right eye constricts concentrically to indirect light. So now I'm going to be testing for accommodation. So can I please have you stare at the wall? And can I please have you stare at the pen? So I see that as a patient stares at a far object, the pupils dilate, and if the patient stares at the pen or at a close object, the pupils constrict. And that proves that cranial nerve 3 is intact, as pupils are equal, round, reactive to light, and they accommodate. So now I'm going to be assessing the patient's ears. I see that the ears are bilaterally symmetric and the same color as the patient's body. So now I'm going to be palpating them, okay? You feel any pain?
No.
Okay. Any pain on the auricle? No. Okay. Any pain on the tragus?
No.
Any pain on the mastoid?
No.
Okay, so patient reports no pain as there's evidence of masses, lesions, or nodules. The mastoid did not have any signs of crepitus as well. So now we're going to be performing a whisper test. So I'm going to stand at least 2 feet away. I'm going to have you cup the alternate ear, and then you're going to repeat the word back to me, okay? Okay? Okay, so the patient has a negative whisper test. And now we're going to be going onto the otoscopic exam. So when looking at the external ear canal, I see that there's no evidence of massive lesions or nodules. And now I am going to pull the pinna of the ear up and back. When looking at the ear canal, I see that the ear canal is the same color consistent to the patient's body, and there's no evidence of massive lesions or nodules. There is a expected anomalous cerumen, and the color is consistent with the patient's ethnicity. When looking at the tympanic membrane, I can see that it is pearly gray translucent, and the cone of light is at 5, with there's also no perforations on the tympanic membrane. All right. So now we're going to be looking at the nose. I see the nose is on the midline, as is symmetric, and now I'm going to be palpating, and the color is consistent with the patient's face. So now I'm going to be palpating the patient's nose, okay? Do you feel any pain or tenderness? Okay, so the patient feels no pain, as there's no evidence of displacement, crepitus, massive lesions. And now I am going to look inside the patient's nostrils. Can you please look up? Okay, so I see that inside the nostrils, there's no evidence of nasal polyps, deviated septum, or irritated mucosa, as well as no massive lesions or nodules. And can you breathe in, breathe out, please, with your nose? Okay, the patient's nose is painted. So the next thing I'm going to be doing is looking at your lips. I see that the patient's lips are bilaterally symmetric, and they are pink and moist, with no evidence of peeling, cracking, or edema. So I'm going to have you open your mouth, please, as I look inside your mouth. Okay, so when looking inside the mouth, I see that the oral mucosa is pink and moist, with no evidence of irritated mucosa. When looking at the tonsils, I could barely see them, so I would give them a +1 grade. Now I'm going to push down. I'm going to depress the tongue, and can you please say ah? So I see that the uvula retracts up and back, which means that cranial nerve 8 is intact. So I'm going to put that over here. And so now we're going to be testing the range of motion of your tongue, okay? So can I please have you point your tongue up, down, left, right? Left, right. Okay, perfect. Patient has full range of motion of the tongue. Now we're going to be looking at the neck, okay? So I see the neck, or the trachea is on the middle of the body, and the color is consistent throughout the patient's body as well. And we're going to be testing the range of motion of the neck, okay? Can I please have you stare up, down, left, right? Can I have you touch your ears to your shoulders? Okay. Now we're going to be testing, okay, so I see that the range of motion of the shoulder, or the neck is the patient has full range of motion of the neck. So now I am going to test cranial nerve 11. So can you please shrug against resistance? Can you please turn your head against resistance? Turn your head against resistance as well. All right, so cranial nerve 11 is attacked with 5 out of 5 strength. So now I'm going to be looking at the patient's upper extremities. Can I please get your nail? So when looking at the patient's nails, I see that it is pink, intact, smooth, with no evidence of cracks, ridges, or discoloration. So now I'm going to be applying pressure on the nails, and I see that they blanch, and capillaries refill with less than 2, which is normal for preparation. And now I'm going to assess skin trigger by lightly pinching it, and I see that the skin is elastic and briskly returns with no evidence of tenting. So now we're going to be testing the range of motion of the upper extremities. So can you please go like this, and out again, and in again. And now, can you please pull against resistance? Can you please push against resistance? Nice. All right. So now we're going to be testing the range of motion of your wrist. Okay. So can I have you close the box? Close the box even more. Open the box. Default position. So we're going to be using our fingers this time. Okay. Close the box even more. Open the box even more, and extend out. And can you extend out against resistance? Nice. Okay. So can you pull? And can you push my hands? And now can you make a fist and open the fist? And now can you grab my fingers? Okay, so I see that the range of motion of the patient's upper extremities have 5 out of 5 strength bilaterally, and with equal grip strength as well. So now we're going to be testing the fine motor function of upper extremities. So can I please have you alternate tapping your nose with your eyes closed like this 4 times, 1, 2, 3, 4. Okay, perfect. So I'm gonna have you tap your nose and then tap my fingers with your eyes open. Go ahead. 1, 2, 3, 4. Nice. I'm gonna have you touch each figure like to your thumb like this. 1, 2, 3, 4. 1, 2, 3, 4. Okay, that's good. And now I'm gonna have you flip your hands like this. Okay. Okay. So patient has full range of motion. Or patient has fine motor function and coordination of the upper extremities. So now I'm gonna have you go like this real quick. So I see that, oh, like this, okay. So I see that the angle is less than 160, which shows no signs of clubbing. Okay, so now I am going to assess your radial pulses. So can you please go like this? Okay, so when looking at the radial pulse, I feel that it's a +2 bound with 60 beats per minute. Now I'm going to be looking at your respirations, okay? So I see that the chest rises and falls evenly with no evidence of accessory muscle use, and I see that it's 16 breaths a minute as well. So now I'm going to be listening to your posterior thorax, so go ahead and turn it around for me. Alright, so when looking at the posterior thorax, I see that the skin is intact with no evidence of masses, lesions, or nodules, and the color is consistent with the patient's body as well. And I also see that the transverse AP ratio is 1 to 2, and now I'm going to be also taking, okay? Mm-hmm. Okay, so can I have you breathe in and breathe out when I say so, okay? Breathe in, breathe out, breathe in, breathe out. I heard bronchial sounds. Can I have you cross your arms, please? Breathe in, breathe out, 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 breathe in, breathe out. Alright, so I was able to hear bronchiovesicular sounds, bronchial sounds, and vesicular sounds at the proper places with no evidence of adventitious sounds such as rhonchi, wheezing, or reels. And now we're going to be assessing the lateral thorax, okay? So can I have your arms go like this? Okay. And I'm going to start. Can you go ahead and breathe in, breathe out, 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 breathe in, breathe out. Alright, so I was able to hear vesicular sounds and bronchiovesicular sounds